Hi, I'm Dr. Blomberg. Welcome to my YouTube page dedicated towards those of you who are curious and wanting to become better at starting IVs. Starting an IV is a basic skill anybody can learn. The traditional way of starting an IV is you go in to the skin with the bevel of the needle up, advance until you see a flash of blood back into the hub, advance a little farther, push the catheter off into the vein, pull the stylet out, hook up your tubing, and you should be done. But if you've been doing IVs for many years or you're just learning, you know that it doesn't always work out and you miss. And so my technique that I'm going to be demonstrating today, which is sort of playing slowly in the background, it's called the flash spin advance technique. I'll work through the steps of that. I'll show you some demonstrations of it. You'll see that it's easy and that anybody can do it. So I'm going to get out of the way and let's get started.
Now focus on the needle tip and the bevel in this first simulation, done in the traditional bevel up method. Dropping the angle, advancing a little bit farther, you see that the needle tip now has penetrated the back wall of the vein, so that when you try to thread your catheter, it's not able to thread all the way in. It gets caught up. The next simulation is of my flash spin advance technique, and I was amazed the first time I saw this. It's always something that I had imagined happening in my brain, but when you watch the needle tip and where it goes once you rotate the bevel of the needle 180 degrees, you'll see that no longer is the needle tip even anywhere near the back wall, but it's up in the middle of the vein, and the bevel is now turned in such an angle that it just glances off of the back wall of the vein and keeps it right in the middle of the vessel, so that you're easily able to then thread the catheter off.
Okay, now I'm going to give you a quick demonstration of my FSA technique, flash spin advance. I'll get the tourniquet back on using that no pinch. First I survey the hand. Need a vein that's at least as long as my IV needle is, and so there's several choices. This one right here is probably going to be the one I'll prep. I'm going to take my alcohol wipe off that area. I'm going to give it a couple of pats, prep it again. Okay, now if you can see, and everybody knows on an IV needle, there's a bevel. And anyway, you start with the bevel up. And so I turn it, make sure I'm going with the bevel up. Once I get my right approach, I'm going to try to bend the hand down, relax your fingers. Get everything nice and tight. Okay, I'm going to enter on the side. And I'm going to go in just until I see a flash. There's a flash. I'm going to turn my needle 180 degrees. Advance it a little farther. Push the catheter off. Put my thumb up there. Take the tourniquet off. Pull the stylet out, hook up my tubing, give it a little flush. Oh, that's right, I have my stopcock set there, so give it a little flush, and we're good. Put my dressing on, tape it in place, and that's it. Get this done first. A little alcohol. Okay. Let me grab. So I've got the angle, so I'm going to start about right there. You ready?
Yep.
Okay. Bevel's up. Flash. Spin. Advance. Thread it in, That's all there is. It's in. On the side, it looks like a most likely first time success. So I get the hand gripped like I do. Stretch the skin tight. All right, here we go. In from the side. You can just watch the vein come in closer if you can, right on that. You might almost see the vein sort of give a little bit when it gets in. You can see the tip right there. Okay, that's it. Spray, cold spray. No alcohol. Pull the skin tight. Bevel up. I'm going to kind of go here so that I've got a straight travel right up the vein there.
I think I'm always afraid to go that far with the needle into the nail.
Straight up that way. Should be good. So I've got a hold of the hand and I'm stretching the skin so everything is tight. Okay, here we go. There's a flash. Give it the spin. Thread it on in. And that's all there is.
You want to hold somebody's hand? Yeah, you can hold my hand.
Thank you. I need to be a baby about it.
No, I'm a baby about it. I don't look.
I don't like watching.
Okay, now I've got her hand. I've got a good grip on it. I'm stretching the skin. So for me, the entry is going to be right there, heading straight that way. Okay? There's plenty of room. The needle, plenty of room for the needle. So I'm going to go in there. Go slow. Hit the flash. Rotate. Advance. In. Thank you for watching today, and good luck in incorporating this flash spin advanced technique into your IV starting strategies. Please remember to check back. I'll have additional YouTubes addressing hand positioning and IV saving techniques. So in the meantime, good luck and God bless. See ya.